AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show. If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm and eventually brings your happy back. If finding your happy is important to you, please call the energy shifter Lorena Anderson at 954-647-5525 to schedule a free half-hour phone session, or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her.
Hi, welcome. I'm Lorena Anderson, your life and energy coach, and this is You and Your Doctor, living a longer and healthier life. We want to welcome you here with us today. This show is being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patience is the heart of their business. And I'd just like to take that moment to let you know we're here every Tuesday evening from 6 to 7, and we have some of the finest doctors in order to help you understand some of the difficulties that you might be running into, some of the people that you might need to call. All County Healthcare has done an amazing job at bringing the top-notch professionals, the experts in their field, to come here to help educate you. So if you have 80 questions whatsoever, you can call All County Healthcare at 888-717-7170. Ask for Maddie. She would love to answer any of your questions, whether they be about after hospital care, whether it's skilled nursing care or certified nursing assistants. But you can also be able to get in touch with the doctors, with the guests that we have on the show. And she would love to be able to answer any of those questions for you. So I'd like to welcome, first of all, we're running live on 1470 AM. And welcome to our new FM listeners. We're on 95.3 FM. And just in case you haven't been able to follow our show tonight or you got called away, we're also going to be airing Tuesdays at 11 o'clock a.m. and 3 o'clock p.m. So in case you haven't been able to see the full show, you can see it again then, or hear it again. And the other thing, too, is that if you know of any of your families or loved ones or friends that are dealing with some issues in their life concerning their medical well-being, have them listen. Have them get on 95.3 FM at 11 o'clock a.m. or 3 o'clock p.m. and have them listen to the show. And just in case you ever want to go back and visit our show as well, our other shows, you can go on allcountyhealthcare.com, where we have all of our shows archived. So if there's something that you might have missed, you can go back there and watch the shows as well. And then just give us a call, 888-717-7170. Ask for Maddie. She would love to answer any of your questions. So I welcome also our Facebook friends on All County Healthcare, because we are live. We are filming live right now. And also wwnnradio.com. We're filming live there as well. So I want to thank All County Healthcare again for the professionals, the experts in their field coming in and helping educate us. And we're going to start with Dr. Michael Cohn. and he happens to be with the Orthopedic Center, and he's located up in Boca and in West Palm County. There's another one also in Boynton Beach and
Boynton Beach, Wellington,
Wellington.
and Lake Worth.
There you go, Lake Worth. So welcome, Dr. Cohn. It's a pleasure to have you here tonight.
Thanks for having me. My pleasure.
Oh, it's wonderful. And I'm very excited because the Orthopedic Center has just some wonderful, wonderful doctors, and they've graced our show many times. And there's so many different specialties, and yours happens to be the upper extremities, the shoulders, the elbows, the wrists, the hands. So we've talked a lot about knees and hips. We've also talked a lot about feet and ankles. So, I mean, the last thing we have left is heads, I guess, right? No.
Probably spines, too.
No, spines,
should
yes.
be next on the list, maybe.
I love it. I love it. Yes, absolutely. So tell us a little bit about you, where you got started, the schools that you attended, how long you've been in business.
Yeah, so once again, thanks for having me.
Nice.
My pleasure to be here. So I'm a South Florida native. I grew up in Fort Lauderdale area. And after graduating high school, I went to Vanderbilt University, studied chemistry and pre-med. And then after graduating, I went to the University of Miami School of Medicine.
Oh, so you pretty much stayed down here the whole time for your schooling, huh?
You know, I like the warm weather, and all my family's down here. It's a great place to live.
I got to tell you, I'm so spoiled down here as well because I'm from Chicago. So, you know, and my daughters are very upset with me. They're like, when are you coming back home? I said, I am home. So I totally understand. There are many people that have left Florida, you know, to do other schooling, but eventually came back down here. So you're a permanent resident. You are a native.
Pretty much so, yes. And, you know, after graduating the University of Miami Medical School, I did my orthopedic surgery residency at NYU Hospital for Joint Diseases in New York City. And I did an additional year there, fellowship training in surgery of the upper extremity, focusing further on hand, wrist, elbow, and shoulder problems. And that's the focus of my practice. I've been in practice about 5 years now.
Oh, wonderful. Oh, great. That sounds fun. What made you decide to go into this field? You know, tell us about what your passion is about it.
Well, growing up as a kid, I really loved playing sports. And like most kids, I had my run-in with some injuries. And probably in my teenage years, I first learned of the field of orthopedic surgery. And had some injuries I needed to be treated. And I was like, this is pretty neat. This might be something I should look into when I'm a little older. I could see myself doing this. And just stem from there. And, you know, when I was in college, I would volunteer in the ERs and sometimes shadow other doctors, a few orthopedic surgeons. Mm-hmm. And the love grew. And, you know, once I went through medical school, you get exposed to everything, and you get to figure out, you know, what you could see yourself doing and what you want to pursue as your true career. Mm-hmm. And you know, I kept an open mind, but I still had that love for orthopedics, and you know, it's really a lifestyle field in that, you know, we're not so much dealing with life and death, you know, which is a good thing, at least for me.
Yes.
You know, that's stressful sometimes. So. I think it's great. We can really help people a lot and help them enjoy life more, enjoy their hobbies more. In South Florida, we have a lot of golfers, a lot of people that love tennis and all sorts of sports.
Oh, and that's what I was going to ask you, because you mentioned a lifestyle doctor, and I've not heard that terminology before, but you're absolutely right, because we are so active down here, and that's one of the things that I love about, you know, South Florida. You're right. You got the golfing, you've got the tennis, you've got bocce ball as well. Right. You know, you got to move that shoulder a little bit, right? And it is just such a wealth of activities that you know, after time, as we all know, you might not know it, you're not of age yet, but after time, you know, the wear and tear ends up. Where do you see the most of your patients? What are they usually dealing with the most?
Well, I see patients of all ages, from children to elderly. And most common things that I see would be arthritis. In South Florida, we do have a certain percentage of older population as well, a lot of retirees. And so we do see arthritis, from wear and tear, the most common type of arthritis being osteoarthritis.
Oh.
We see that a lot. We see rotator cuff tears quite a lot.
Yeah.
Carpal tunnel syndrome, and then being so
that's
active.
in the wrists and everything, right?
Oh, yeah.
Yes.
Carpal tunnel is very, very common.
What about elbows? When I was playing golf, and I've only been playing for a couple of years, right? I've got to tell you, I've decided that that's a really dangerous game, believe it or not, because I ended up pulling one of my muscles in my arms, just trying to hit this little white ball.
No, you're absolutely right. I actually wrote an article on golf injuries because, people, just like you mentioned, people think this is a pretty benign activity. They see grandma doing it, grandpa, that was his favorite sport, right?
Yeah.
So we don't think that it's a physically demanding sport where you could have injuries, but in fact, there are quite a few injuries that we get in golf, and they're not so many fractures and things like that. It's more overuse, repetitive injuries, a lot of tendinitis, rotator cuff, strain, and golfer's elbow is a really common problem with the inner part of the elbow, sometimes from overdoing it or poor mechanics. And
I'm probably poor mechanics. When I go out to play golf, everybody wants to play with me because my handicap is so beautiful. They just love it. I have a 40 handicap. They love me.
Well, you could be a great partner in a scramble with a handicap involved. So,
absolutely.
It definitely helps.
But I have noticed, and I'm so glad you're talking about that, because I have noticed, like even in the shoulders, and in the rotator cuff area, and explain to our audience what the difference is. How can they tell it's a rotator cuff damage or hurt versus one of their muscles or inside the joint? Or explain to us a little bit more about that.
Yeah, that's a great question. So shoulder pain is one of the most common things that I see, and most commonly it's insidious in onset, meaning just kind of comes gradually along and progresses to a point where they seek out somebody like me.
How long does that usually take?
It can, if there was no real injury, it can most often be kind of a degenerative, little by little wear and tear process over the years, just from activities. But as far as how would someone kind of know what they might have, the two most common causes of shoulder pain, or let me say the two very common causes of shoulder pain in the older population would be rotator cuff problems and shoulder arthritis. And as far as symptoms, arthritis of the shoulder, you're going to have a lot of, as it progresses, a lot of loss and limitation of your range of motion.
Oh, okay.
And as a result, you're going to lose some strength. You're going to sometimes feel some popping and catching inside of your shoulder.
Oh.
That's from bone spurs popping against each other, for example.
God, okay.
Whereas rotator cuff pain is often activity-related pain. But people also do have, very commonly, a lot of pain when they sleep on the affected shoulder.
Oh.
With rotator cuff problems.
Yeah,
sometimes also shoulder arthritis. But sometimes weakness with rotator cuff tears. Difficulty with overhead activities like serving. We were talking about tennis.
Yeah, we were talking about tennis, and I'm like, oh yeah, I've felt that once or twice, but I think for me now more it's just in the wrist, the ability of holding on to the tennis racket. That for me is kind of hard to do anymore. So I took up golf. That's it's a wonderful thing. It is. I do enjoy playing golf, but what I really like is the fact that there's doctors like you out there, that are helping us be able to have that lifestyle and to be able to enjoy the later lives as well. Because sometimes it's very, very difficult. If you're in pain, many times you just don't even want to go out. You know, you isolate, or maybe you just go, to the country club and just sit back and watch everybody else, and then you're feeling bad because you can't play because you're in pain.
Exactly. I mean, we all work very hard during our lifetimes and our careers, and we're looking forward to those golden years where we can
Yes.
kick back and
Yeah.
relax and finally enjoy some of those hobbies that we tried to develop in our younger years. So you want to feel good, you want to feel able to do these things. And fortunately, in my career, I'm able to help a lot of these people, and it's very rewarding.
Oh, that's wonderful. I remember, because I was also a fitness trainer at one time, and I remember that there was a couple of the people that I worked with that either had rotator cuff tears or they had surgery on them. And the one gentleman, he waited for almost 20 years before he finally went in for surgery. And I found that to be astonishing. I'm like, how can you deal with that for that amount of time?
Yeah, people are quite different. I definitely see a lot of folks that are of that kind of mindset, that they really are maybe afraid of surgery, or for whatever reason, they just really hold off on something that might have been able to really help them a lot.
Yeah.
And they wait until it's so far along.
It
Whereas
is.
maybe they should have considered it a little earlier and had some more time to enjoy certain activities.
Exactly. And one of the things that I keep saying is that if you're dealing with one of these situations where, it's been chronic for, a period of time, 2, 3, 4 months, it's been pretty much chronic. The time to get this fixed is right now. Don't wait for another 6 months waiting for it to go away, because usually it doesn't go away. Number one. And number two, you're still young enough where your healing time, the healing process takes a lot less time than if you wait for 2 or 3 or 4 years later on. Because the older you get, the harder it is for the body to heal itself. So
That's absolutely true. I usually recommend, when I'm talking to patients, sometimes they ask me about, this doesn't hurt right now, but it often does. What should I do about it? You might want to try basic things you can do on your own first. Rest, avoid that activity that was aggravating that sore shoulder or sore wrist, whatever it is. Maybe try some over-the-counter medications if you don't have a contraindication, like Tylenol is usually safe for most people. Ibuprofen, Advil, these sort of medicines.
yeah, I was going to say the anti-inflammatories to bring down that inflammation that's
Yeah.
in the joint.
And you check with your primary doctor if these things should be safe in your particular case. But these are simple things you can try on your own. And if it's not feeling better, 4, 6, 8 weeks, go in and see somebody like me and get a thorough evaluation and see if something else needs to be done to help you along.
That's a perfect segue. How did they get a hold of you?
So it's easy to get a hold of me. I'm in the office every day, part of the day.
Okay.
I'm often in surgery the other half of the day, so kind of try to be everywhere.
Yes.
But we have 3 offices. We have one in Boynton Beach, one in Wellington, one in Lake Worth. 3 beautiful offices. I'm in a great group, the Orthopedic Center in Palm Beach County. Myself, along with my partners, we cover all these subspecialties within orthopedics and musculoskeletal care. We're all...
And his name is Dr. Cohn. I just want to refresh our
Yes.
audience, and also give them your telephone numbers so that they can call.
Yeah, absolutely. So our office number is 561-967-6500. And
Website?
the website is, it's easy. It's an acronym of our business, ocpbc.com.
One more time.
www.ocpbc.com.
Okay,
and
great.
You can read all about me. You can read all about my partners that deal with other body part problems. And we also have a lot of educational material on there that you can peruse.
Excellent. That's wonderful. And I just want to say thank you, All County Healthcare, for bringing these professionals, and especially Dr. Cohn, into the show so that we can help educate you, so that you can begin to identify, especially if you've got something that's chronic that's been going on for a while. Don't wait. It's just not worth it. Just go to the doctor and give Dr. Cohn a call and let him know, what's bothering him. And also, if he can't help you, there are many specialists in his office that can also help as well. So, maybe it is the spine or maybe it is the hip, but you're feeling the pain up in your shoulder. Sometimes it's the ability of just identifying where that pain might be coming from.
That's absolutely true. And to have a doctor that is an expert in your particular body part, I think is really the way to go these days. There are lots of very well-trained orthopedic surgeons that really specialize in certain areas and can really develop a lot of expertise in certain problems. For me, other things I really have a passion about are shoulder replacements and arthroscopic surgery of the shoulder, elbow, wrist, and hand.
Wow.
Minimally invasive surgeries such as endoscopic carpal tunnel release. And I think minimally invasive surgery is really the wave of the future in my field, and can minimize pain and get people back to their activities a bit faster and with less pain.
So what are some of the preventions that we can put into place so that the wear and tear isn't so difficult on our joints?
So my best advice would be try to, some people have certain hobbies that they're just fanatical about. And some of these aren't the greatest probably for the long term. But, I would avoid, in general, really strenuous exercise. I see a lot of, young to middle-aged guys that been lifting heavy weights their whole lives, and their x-rays look like they're about 50 years older than them. So that's taught me through experience that, I think...
and I see a lot of that too at the gym, just these muscle-bound men, and I'm
guys like to look big and impress the women, or impress their friends. But
yes,
probably for the long run, in my opinion, that's probably not the best thing to do for your joints for wear and tear. So I think it's good to be healthy and exercise, but lifting super heavy weights with maybe bad form in doing so for many, many years. I see a lot of people with not only arthritis, but a lot of tendon conditions, rotator cuff tears, biceps tears. So I think exercise in moderation is the way to go. You get all the benefits with minimizing the risk of long-term damage.
Right, and usually what I had told my clients was, I said, let's not do the really heavy weights. Let's do less weight, but more repetition on it. So instead of, doing, say, 50 pounds and you're doing 3 sets of 15, I said, let's bring it back down to about 35, and let's do 4 20 reps, 4 sets of 20. And then that way you get the burn, and that's what you want. You want the muscles to, shred, I guess.
Exactly.
And the more that it shreds, the more you build the lean muscle mass. And the lean muscle mass is what ends up eating up a lot of the calories.
That's a nice benefit, right?
It is.
Can look good and
feel good.
Have some more muscle to burn those calories. And eat what you want a little more sometimes.
Absolutely. Absolutely.
I agree.
So, so it's one of the things is don't lift a lot of the weights, and that's very important. What are some of the other things that we might do to help prevent injury?
I would say another thing, just try to maintain a healthy weight. That's going to benefit you in all respects of health. Trying to maintain a healthy body weight is going to lower your chance of not only arthritis of your hips and knees, the weight-bearing joints, but also diabetes, heart disease, all the major killers.
Yes.
And it'll help you live a happier, longer, healthy life in general, not just from a joint standpoint, but overall health standpoint.
It also reduces the stress, and stress, as we all know, also is one of the number one killers.
Yes.
So, well, I can't thank you enough. Thank you so much for coming and being a part of our show, for teaching us and educating us on the body parts, the joints, the rotator, the shoulders, the elbows, the wrists, the hands. So it's really been a pleasure to have you here.
Well, It was a pleasure coming here. Thank you very much, and love to do it again anytime.
Okay, great, great. Well, we're going to break now for commercial. And stay tuned. We also have another guest that's coming on, another doctor. And I've got to tell you, he's got tons of information as well. So stay tuned. We'll be right back.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
Know your body, gain control of your health, transform your life. If your body could talk, what would it tell you? At DexaFit, we show you how to take control of your health and fitness to live a happier, more fulfilling life. Hormones, metabolic health, and cardio fitness all play a significant role in your energy levels, sleep quality, and overall well-being. With our proven methods of measure, track, and discover, we show you how your body composition, cardio fitness, and metabolic health compare to your optimal level. At DexaFit, our goal is to help you identify and understand the health and fitness of how to transform your body to meet your individual goals, break through your plateaus, and take the guesswork out. Improve your energy levels, sleep, and weight. Give us a call at 561-923-8833. We are conveniently located at 2499 Glades Road in Boca Raton. Schedule an appointment online at DexaFit.com. Give us a call, 561-923-8833, and mention this ad for special pricing.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach, and also your host for this evening. You and Your Doctor, Living a Longer and Healthier Life, presented by AMP2 TV and probably sponsored by All County Healthcare, where patients are the heart of their business. And I've got to tell you, I can vouch for the ability that they have of being able to be compassionate, of listening, taking the time to really work with whatever needs you might have. And I'd also like to thank them for bringing on our guests. They have done an amazing job on bringing to us some of the superstars in their field. So I would just like to thank them again for all that they've been doing to help educate all of us. You, our audience, myself as well. And you can watch us. You can listen to us on 1470 AM. We're also on 95.3 FM. So listen to us there. Or you can watch us live on Facebook at All County Healthcare, where we're streaming right now. So welcome our Facebook friends. If you have any questions whatsoever for All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any of your questions. And that's also a great way to be able to get a hold of the doctors as well. So without any further ado, we have another fabulous doctor guest on our show tonight. And his name happens to be Dr. Michael Joyner. And he comes to us from his own private practice called the Joyner Hand. I love that. The Joyner Hand.
Great. Thank
Very
you.
cool. Very cool. So welcome to our show tonight. And tell us a little bit, first of all, where did you do your schooling? Are you a Florida native, or did you move here? Or give us some background about you.
Well, first of all, thank you very much for having me. I appreciate it. Just give you a little background. I'm originally from Los Angeles, California, where I grew up. Exactly.
Wow.
Went to high school there, started college out there, UC Berkeley.
My goodness.
Then went East Coast, Howard University. Graduated from Howard University.
You went from one coast to the other coast, huh?
Yes. And then I did medical school at Georgetown University.
Oh, my goodness. One of my other favorites.
And I served in the Army. They paid for school. So I did 5 years as a captain in the U.S. Army. And then I did general surgery, my background, general surgery. So a lot of trauma surgery. I was based in Atlanta. And then I decided to go into the subspecialty, hand and microsurgery. And I did my training in Louisville, Kentucky.
You've been all over the board
So
here.
my exposure has been a wonderful experience in many different ways. And the hand surgery in Kentucky, we did really one of the first hand transplants there. So it was an incredible institution.
Oh, my goodness.
Right.
You're kidding.
So
Oh,
I was
my
very
gosh.
fortunate to train there.
That is
Exactly,
incredible.
exactly.
That is incredible. Well, when you're talking about the hand, you're talking about such delicate tissues and veins and muscular muscles,
You're absolutely,
ligaments.
You're absolutely right. You're absolutely right. I put it in the category of microsurgery because really everything in the hand is very small, very tedious, very important.
Yeah.
So it's a field that I love. You go from anyone from age 2 to 92 in a day that you may see. And sometimes you forget how important your hand is.
Oh, no, I never do.
Right.
Oh, no. I know how
Right,
important.
right.
And I think that one of the things that makes you really realize how important it is if you have an injury on your hand and all of a
Exactly.
sudden you can't use it anymore. Then all of a sudden it's like, oh, boy.
Right. Exactly.
Unfortunately, we all take our bodies for granted. And it's until we end up with some level of or injury do we understand how important that body part is.
Occasionally, I would do some mentorship programs to young kids, and I would go speak to some of the schools. And I spoke to a group of 4th and 5th graders, and I had them tape their thumb and try to write.
Oh, my God.
Right. And
That
so it
is
was an
fabulous.
incredible experience. So
That
that's just an
is
example.
fabulous.
That's an example.
That is wonderful. Well, and I kind of understand that because, I've been dealing with like a little bit of, thumb issue for, I think, like a couple of years already. And it just, comes and goes. But I do understand that all of a sudden, I can't open a bottle top
Right.
or a jar. It's very, very tough. Or the other thing, just squeezing shampoo into my hand.
Right. It's so important. It's so key. And a lot of the things I focus on in the practice is exactly that. So when someone comes in with an injury or pain, we definitely look at each person differently because the amount of work you're doing or your hobbies makes a huge difference in how you treat the hand. It's definitely not cookie cutter. And so if you're right-handed versus left-handed, you have a hobby. Someone may be gardening, someone may be knitting, someone may be doing carpentry.
Golfing,
Exactly. Tennis.
lifting weights.
Tennis,
Yes.
exactly. And
Yeah.
everybody's just a little different. So that's one thing I love about the hand as well, because you'll take extra time and not only doing your history and physical, but you're really taking time to get to know, okay, what's our goal here? What are we really trying to do? Are we trying to get back on the golf course? how many
I
times
don't
a
know
week,
of any,
that
yeah,
type of
I
thing.
don't know
Right,
of any
exactly.
golfer who doesn't want to get back on the
Right,
golf course
right,
as
right.
quickly as possible.
Exactly.
You know, and for some of those golfers that are just really fanatics, I mean, you're talking 3, 4, 5 times a week.
It can make a difference.
You know,
right.
and sometimes they can do that because of retirement, and so yeah, a little
Exactly,
overdone,
exactly.
unfortunately.
And when you say overdone, overuse injuries are something I see quite a bit.
Oh, okay.
One example is classic carpal tunnel, which can be overuse of your hands. But I always like to use one example. I had a pianist who came, and they really were playing a lot of their instruments, and they started to get the symptoms of like a carpal tunnel.
Tell me what the symptoms are. I don't mean to interrupt you, but you know, sometimes I hear it all the time. But
Right.
what do they experience when you have it?
Classic symptoms, one will have numbness and tingling sensations in their fingertips. Most
Okay.
commonly, it comes at night. So it's almost as if your hands fall asleep.
Oh,
Exactly.
Okay.
And so what it is sometimes you're putting a little too much pressure on the nerve. And when you bend your wrist, you put pressure on the nerve that goes to your fingertips.
I see.
And a lot of times with overuse, you'll keep irritating the nerve. So there's different treatments. And in general, if you get to it early enough, you don't have to have surgery. A lot of people think they have to have surgery when they have carpal tunnel.
Really?
But it's not true. If you address it early enough, and in this example where this person was playing the piano, I mean, for concerts and every day, and they really stepped up the amount of practice they were doing, and they started getting these symptoms quite a bit. Well, we were able to analyze his ergonomic position of his hands.
Oh.
And just by going back in the basic fundamentals, we were able to treat the carpal tunnel by taking steps back, changing the position of his hands. And we didn't, no surgery, no anything corrected. Just some splinting at night, but that was it.
That's amazing.
Right, so it was amazing. So every person's different.
So then he was playing like this? No, I'm teasing. That's
Right,
that's
so it's good.
amazing.
So that's
because-
one of the common things I see in the practice.
Okay.
One of the common things I see.
What else? What other common issues do you find in your practice?
Well, I definitely see a lot of traumatic injuries. So, say someone breaks a glass in there with a dish, they may cut a tendon, may cut a nerve, or a broken bone in the hand, finger, wrist. But in general, besides trauma, I'll see a number of people with arthritis. So, especially arthritis in the thumb. They have difficulty turning a key or have pain. And there's so many different treatments for that too. And that's one thing. Some people don't realize that there are treatments for arthritis.
I know.
And a lot are conservative, you know.
Really?
And you go to extremes. So you could start off with, it could be something as simple as splints or sometimes a steroid injection or analyzing your hobbies. Or to the extreme, I'll replace a joint, almost like someone's hip. So they'll have a ball and socket for their thumb to eliminate.
Really?
Right.
You
And
know
it's-
something we don't hear about
Right,
that.
we don't hear about it, exactly. And so that's the
we
thing.
hear about the hip. We hear about the knee.
Exactly.
And tonight, with the other doctor, with Dr. Cohn, we heard about
Shoulder,
shoulder
right.
because I really don't hear very much about shoulder, but with the hand.
Exactly.
Oh,
We
my
do the full
goodness.
replacement in the thumb.
Really?
Exactly. We'll even do in the wrist if necessary, different joints, full joint replacement. And then some of the most basic things I see every day are like a trigger finger where your fingers lock up. And so many people don't understand that if their finger starts to lock and click, that the sooner you treat it, the better. Because if you wait too long, then that's when sometimes you may need surgery.
Oh, okay.
Right.
Our audience, this is really important. If you hear locking or clicking in the joints,
Yes.
get to the doctor.
Yes.
Call Dr. Joyner.
Yes.
How do they get a hold of you?
You could go on the website at drjoyner.com, DOCTORJOYNER.com, or you could call us directly, 561-922-9396. The practice is the Joyner Hand, and again, my name is Dr. Michael Joyner.
Very good.
Right.
And in case you didn't get that, you can also call All County Healthcare Telephone number there is 888-717-7170. Ask for Maddie, and she can get you in touch with Dr. Joyner as well.
Yes.
Excellent. Now, as one of the things that you had just said that I found was really interesting is that you're starting to replace the joints in the thumb area. What other state-of-the-art remedies are you seeing, or surgeries?
Right. One of the things that I like to focus on in the practice is, just as you said, new and innovative things.
Right.
And our goal is to avoid surgery when we can. But when we need surgery, we fix it. But if we're able to prevent that, I think that's the way to go. So some things that are new and innovative are such as regenerative medicine, we call it, like the stem cells. We hear a lot about it with the knees and other locations, but now we're starting to do it in the joints of the hand and wrist.
Really?
And so it's very exciting,
That
especially
is
with
very
arthritis
exciting.
or a small tendon tear, and you want to avoid any, again, surgery or long-term casting. Sometimes regenerative medicine is a way to go.
Well, that is absolutely
So
fabulous.
it's exciting.
It is exciting.
And then even on to just anti-aging. We even focus on the focusing on the skin, and we talk about the vitamins one will use, as well as vitamins that will help for nerve, whether it's vitamin B6, the amounts, the dosage, also anti-aging for fillers. We talk about that if people are interested in it. So really we look at the hand as just a part of your entire wellness. So that's what we love about our practice.
I love that. I really do. And, you know, I think that is so, it's the new state of being a doctor and what they have to offer now. You know, it's just not... come in, let me see what you're doing. Oh, okay, no surgery, and then you're out, and then they don't do anything else.
Exactly.
I mean, I love the fact that it's holistic.
Right, and I
Holistic
believe
in
in
its
that.
way.
I'm a big believer in
I
it.
am
And
as well. I'm totally
Yes.
anti-aging, honey. I'm totally anti-aging. Yes, absolutely. But that you know, incorporate, you know, diet, exercise,
Exactly.
vitamins,
Exactly.
you know, skincare, fillers as well. I
Right.
mean,
And people
all
don't
the
think about that with the hand, but that's so important.
Oh, it is,
so,
and you know, and I know a lot of people that have come in to have fillers in the hands.
Yes.
You know, to gain that youthfulness,
Exactly.
and also to do laser treatments on it to remove any of the sun damage
Right.
that might be on the hands, because you know, you're doing it for your face. Well, a lot of people are doing it. A lot of women and men are doing it for their face, but when you take a look at the hands, it tells everything.
You're absolutely right.
So
You're absolutely right.
That's fabulous.
Exactly. And then exercises in the morning, stretches, so important. Especially nowadays, we see a lot of people texting and using their phones. So you're getting more movements with single digits and normally.
Yeah.
What I'm starting to see in the practice is that I see a little more tendinitis maybe than I've seen a few years ago. And then, well, it makes a difference in how I would treat someone as well. I might keep them in a splint, maybe longer, if I know they really have to text too often and we just did surgery. But those are things that now
Can you just put a cast on their hand?
Exactly. If they're 12, we may have to. You know?
Yeah, exactly.
Right.
Exactly.
So again, that goes back to the individual as well as the sign of our times.
Yes.
The sign of our times.
So I just like to take this moment to say thank you to All County Healthcare for bringing one of the top-notch professionals in hand surgery on our show. It is such a pleasure, Dr. Joyner, to have you here and you know, explaining the various issues that that our society is dealing with at this moment, and addressing them and what to watch out for. You know, so
Exactly. And in saying that, what we feed on in the practice as well as here in Boca Raton, we always say, as a Boca Raton hand surgeon, and there's so much more. So we talk about so many different aspects of hand and health and wellness and how it all plays a part.
Yes.
Even to the point where we even I like to share that I designed even flatware that's ergonomic for your hands.
Really?
So it takes pressure off of your hands when you cut, when you use it, and especially for someone with arthritis, it can make a difference. And the primary reason is it avoids germs on the table. So coming from a surgical perspective, knowing being in the operating room, I mean, everything's sterile.
Right,
So
right.
I look at it to the extreme, but at the same time, bringing it into our daily lives. And if you go out to dinner, you'll realize we subtly put our flatware on napkins. We put it on the edge of the table. Mm-hmm. But with the touchless flatware that I invented, you just set it down and it avoids all the germs on the table.
That's so exciting. So tell
So-
me, did you bring a sample for
Oh,
us?
I carry it with me wherever I go.
Do you?
Right, I
Okay.
do. So I started.
Can you show it
right.
to us?
So I have, for example, this here is a touchless fork, and so when you set it on the table, I don't know if you can see,
Oh.
but it avoids all the germs on the table.
Well, here, we can do this. Okay?
Right.
Well, we'll set it up here.
Here we go. Yes.
Okay.
So here it is. So if you look, and here's this piece of paper. You could see if you had anything on the table.
Oh, that is
Right.
amazing.
So for example, if you're outdoors
Uh-huh.
in a patio and you just need to set the flatware down, you don't have to worry about the germs
That's
on the
ingenious.
table, which is incredible.
Yes.
And then as a hand surgeon, knowing the hand is nothing straight about the hand. So I designed the flatware to use in our hand. So it's curved. And even it has support.
Oh,
So
look
even
at
if you're
that.
cut and if you say pick up a tomato in a salad or a scoop of ice cream or anything like that, you have much more support. It takes pressure off of your joints. So when I say we do
love
more,
that.
we're looking at every aspect of the hand and how it helps things that can help in our everyday living.
Ah,
Yes.
so have you patented that now?
It's
Have you
patented.
got- yeah,
It's patented
okay.
because it has.
Where can we get that?
You could get it online. You still go to drjoyner.com and you'll see touchless flatware, or you could go directly to touchless flatware. It's on Amazon. You can order it on Amazon.
That is wonderful.
And now we're designing all types. So you have the plastic, children's wear coming out, steak knives. So it's very exciting.
It is very
It's a whole new
exciting.
line
It is. Well,
that makes a difference.
one of the questions I usually like to ask is, what makes you different than someone else? And I
Right.
think you have really hit the ball out of the ballpark here.
Well, I'm glad because
that is
I
amazing.
take it. I feel with medicine now, you have to incorporate our entire way of living.
Yeah,
even though we're so subspecialized.
Right.
So, right.
Holistic.
Exactly.
Absolutely. I'm, a life and energy coach, and I kind of work in that same realm, holistic. Because
Exactly.
everything affects you.
Right.
It's just not your business or not just your spouse or it's the whole entire
Exactly.
realm that
Exactly.
affects you. So, boy, let me just see. Can you see that?
There we go.
Isn't that amazing? So when it sits down on the table, it's never touching.
Correct.
That is very cool.
Correct.
Very cool. So, and that's great for,
Perfect for gifts as well,
Yeah.
wedding gifts and
pretty soon. Okay, then we're going to have swirls on the back end of it.
right.
For
Exactly.
wedding gifts, I love it.
Exactly.
Oh, that is
Exactly.
wonderful. And it has just been such a great pleasure to have you here. That is so exciting. Now, do you have any of the do you have knives and spoons with you
Right.
as
So,
well?
for
or-
example, we have a 20-piece set. So
Oh, okay.
it has a salad, fork, regular dinner fork, knife, soup spoon, the whole 9 yards.
Oh,
And so that's
great.
for a table setting of 4. So it's a 20-piece set.
Uh-huh.
And then we have chopsticks coming out, touchless chopsticks. I have a patent on that as well.
Oh, my
A
goodness.
patent on the children's touchless flatware as well. So it's exciting.
That is
it's
very
definitely exciting. It's
exciting.
definitely exciting.
Oh, my goodness. I love it. I love it. That is great. That is great.
Yes.
So, what other things can you inform us about when it comes to the hands, using the hands?
Yeah, a couple things.
Yeah.
So we go on, there's such a large spectrum when we're dealing with the hand. because we talk about definitely conservative treatment in anything we do, but then there's a role of surgery when necessary. So I still stay in touch with University of Louisville, Kleinert Institute. That's where I trained. And so we still have a pipeline here in Boca Raton for even a patient that needs hand transplant, even to that extreme.
Really?
Right.
Wow.
So they're still doing hand transplants at that institution, which I'm tied into. So that's exciting too. So when you're looking at all aspects for hand, you go from one extreme all the way to the other for conservative treatment versus hand transplantation. So it's
That is incredible.
very exciting.
Yes.
Yes.
And when you transplant the hand, does it still work as normal, or
Right.
how does that
So
happen?
That's the whole thing. So you're really in the hand, you're looking at the bone, the tendon, the artery, the nerve, the veins. And so each is reattached. And so when I was there, we had a person that had a hand transplant. And so he was able to now follow up once a year to where he could pick up, for example, a glass, an item, and have a small pinch and use it to have a drink or have a dinner or pick up a utensil where he couldn't before.
Wow.
Right. So those are the things that can make a huge difference in someone's lives. So that is exciting. To hear even one procedure where if, for example, someone has extreme wrist pain. And I like to use the example of lifting milk, like a gallon of milk. And they have no problem lifting, but then to turn it to pour, sometimes there's a problem. A lot of that joint, that area, can be from arthritis. It could be from a small tendon tear. And there's a lot of research in that. And that's where we use regenerative medicine in that case many times.
Okay, so
And
the stem cell.
The stem cells.
Okay.
But on the extreme, I would replace that joint. It's almost with a ball and socket where someone can rotate their wrists. And a gentleman who just finished, it was incredible because he was a farmer and hard worker. And so he would still lift and he went right back at it. But what he said he can now do was his small dog that his wife had, he could not lift the dog up into the chair to watch TV with him. And then after the surgery, it was no problem.
Oh, that's
So
that's
that
incredible.
it was incredible. So
Yes,
something as simple as that, we
But,
forget.
I got to tell you, that's not
and
so
that stood
simple, though.
out.
I'm one of the biggest animal lovers, anyhow, and my dog is everything. So I understand that.
Yes.
That
made a difference in
that's
his life.
that's so great. That is so great.
So yes.
What are some of the other things that you're seeing as well? Some of the other people that you work with, or things that you have to deal with the hands. You said carpal tunnel. You said the joints.
Right. Exactly. Also with the nerve, sometimes it's a tingling sensation or weakness in the hand that could be from a different nerve. Sometimes it's from the elbow.
Oh.
So sometimes we'll do what I call cubital tunnel release. And it's similar to carpal tunnel, but it's carpal tunnel at the elbow. And a lot of times people just misdiagnose it.
Yeah, I've never heard of that
and
at
that's
all.
the thing, exactly. There's another one I see a lot of for new parents and new grandparents especially. They get a tendonitis in their wrist, and it's from picking up the little ones and the repetitive motion. So that's another example of something I see quite a bit, but sometimes it goes misdiagnosed. They think it's something else.
Yeah.
Or they say, oh, maybe I just strained it.
Yes.
And then they don't treat it, and it gets worse. And that's when I have to take care of it. But if you get to it early, in general, you don't need surgery. There is a surgery to fix it. But 9 out of 10 times, if you get there early enough, you could treat it. So I see a lot of that as well.
Wow. Yeah.
Tendinitis,
I've not heard of that. Carpal tunnel in the elbow.
Right. Exactly.
And that's such a delicate place.
It's a delicate
anyhow.
place.
Oh
Exactly.
my goodness!
Exactly.
You hit that the wrong way, and
Well, that's exactly what it is. It's just like your funny bone.
Yeah.
That's the nerve that's irritated, that's going through a canal that's too tight. And sometimes that canal has to be released, or certain therapy techniques, stretches can help improve that.
That's so wonderful.
Yes,
Well, thank
yes.
you again, Dr. Joyner. It's been an absolute
Well, I
pleasure to
appreciate
have
it.
you here this evening, helping to educate us. Also gave us some more insight as to some of the other symptoms that you might be dealing with. And if you have any questions whatsoever for Dr. Joyner, just please call All County Healthcare. Ask for Maddie. The telephone number is 888-717-7170. Listen, we'll be back next Tuesday, okay? Every Tuesday between 6 and 7. So make sure you turn us on, whether it's 1470 AM or 95.3 FM. Watch us on live stream, Facebook, on All County Healthcare, and also allcountyhealthcare.com. Come and see us. We'd love any questions that you might have. So thanks again. Have a great evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.